Welcome back. $33 million will be set aside to help social residential home operators raise their standard of care services and improve the welfare of residents. Now, Singapore passed new laws to enhance the quality of care at such homes through a new licensing framework. Some MPs had raised concerns on additional costs operators may have to bear to meet these new regulations.
With all homes grappling with a lean workforce, will the new licensing requirements lead to a higher regulatory cost? What is the expected increase in costs that MSF projects will be passed down to consumers? Will the one-off transition support package be sufficient in helping the homes transit to the new licensing regime?
A licensing regime, while well-intentioned, also involves the meeting of government-mandated standards in staffing requirements and other service quality matters. This will involve both upfront and recurrent costs on the part of social service agencies, SSAs, operating these homes. May I know how MSF is reviewing its funding arrangements with these SSAs?
We do not expect the regulatory costs to be significantly higher than today, as the requirements build upon existing legislation and service requirements that homes are familiar with. MSF and the National Council of Social Service, NCSS, have set aside a $33 million transition support package. With this funding, homes will be able to invest in training for staff, updating or installing CCTV systems, and change management efforts as they transit to this new licensing regime.
Measures to ensure high standards and quality among social residential home operators have been outlined in the new laws. Now, background checks by the ministry will be made compulsory for all full-time staff. This will include vendors and licensees who have direct contact with residents. Prior to this, funded homes have been required to submit the names of staff for the ministry screening. The use of force on residents by unauthorized staff will be prohibited. Clear guidelines on reasonable force and the types of restraints that can be used will also be set out. Currently, some homes are permitted to use cloth bans on residents. Now, inspections will be conducted by an independent board of visitors across all homes, and these unannounced visits will be used to check, provide feedback, and ensure standards of care. It will also be an opportunity to share best practices. The penalties and regulatory actions for offences will also be increased. Now, for instance, the unauthorised operation of a home will be subject to a $100,000 fine, up from $5,000 currently. The ministry will now have the power to appoint another operator to take over a failing home to ensure services can continue. The step-in powers are a temporary measure till more concrete plans can be established for the failing home.
MSF will adopt a risk-based regulatory approach. As a start, we will license social residential homes that provide long-term and 24/7 residential care. Should the needs of clients in other home types evolve, we will review whether to extend the licensing regime to these homes as well.
Operators say the new regulations on social residential homes will provide clarity on industry practices such as the use of restraints on clients. They also welcome more accountability and funding that the law will provide. Currently, only sheltered and children's homes are licensed, while another 25 homes operate solely under funding agreements. Chloe Teo with more.
Around 1,600 seniors across the island are residents of homes similar to this one. For many, staying in a welfare home is a last resort when there's nowhere else to go and no family to turn to. Here, they have 3 meals a day and, more importantly, a community that cares for them. New laws will ensure that the standard of care they receive is consistent across the sector, such as clear parameters on the use of restraints on clients.
Like right now, the enforcement measures are rather limited, penalties and regulatory actions. So with the new enforcement framework, there will be like stricter guidelines and all that. But I guess it doesn't sort of deter us, but actually will sort of strengthen the accountability on our part, because overall we would like to see, the overall rehabilitation of the residents and overall well-being is maintained at a high standard.
To help in transitioning to the new regulations, operators like 4S will have access to a support package. This can be used to send staff for compulsory training in areas such as fall prevention or even suicide intervention. Homes will also be required to install CCTV cameras across their premises. The cost, which can be offset using this package. For licensed operators like Chensulan Methodist Children's Home, the new law is seen as an affirmation for the quality of care it already provided.
So in this home, we're always striving, thinking together, and at every level of staffing, contributing ideas as to how to improve the care of a child. And every child's needs would be different from the others. So it's a very meticulous, painstaking effort that you keep updating, you keep adjusting, and that's why the licensing of the government is very clear and stringent, and it's a good thing, because we got to make sure if we take children from unsafe settings, we must be a safe setting for the children, and that's an absolute.
The new law is set to come into effect in 2026. It may cover other premises such as crisis and transitional shelters in the future.